medical device or healthcare industry when it comes to data that brings you closer to your customer is something like 10 to 20 years behind compared to more advanced industries like consumer retail.
Welcome to the Medical Sales Accelerator Podcast. I'm Zed Williamson.
And I'm Clark Wiederhold.
This podcast exists to put scale to the value you get from those great one-to-one conversations at conferences and sales meetings.
All the market data you could want and none of the BS.
That's why we're speaking with our guest today, Paul Hofschmidt, founder and CEO of Alpha Sophia, a cutting-edge commercial intelligence and engagement platform empowering medical device marketing and sales teams. Paul, thank you so much for joining us today.
Thank you, Zed. Thank you, Clark. Thanks for having me.
So, Paul, you have an interesting origin story of why you and your partners even started this venture. What was that turning point for you?
Yeah, that's a really good question. So I've been working in different industries in the past, having done a lot of commercialization projects and topics, particularly in the consumer goods and retail industries. And then a few years ago, I started helping some friends build a company in the healthcare sector for the first time. It was actually my first touch point with the healthcare sector in a commercial sense. And when we did market research and try to estimate market sizes, look at different potential customer groups, we found it was really, really difficult to actually get access to high quality data at a reasonable price. So we looked at some of the existing solutions in the market, and it would have costed an arm and leg to get started. And that's when I was actually first confronted with the problem that it's quite difficult to get access to that data as a startup company, to then use that to build innovative solutions on top of those insights.
So you come from another industry, and would you say that you were surprised, like when you witnessed that outcome? Like, you're coming in here, okay, we got to get some market data, we should be able to have some easy access. Like, how surprised were you that it was not only difficult but so costly?
Yeah, to be honest, my first feeling was that the medical device or healthcare industry, when it comes to data that brings you closer to your customer, is something like 10 to 20 years behind compared to more advanced industries like consumer retail, where basically companies know so much about their customers, build different cohorts with different personality types, and then design their sales and marketing approach to those personality types.
I want to just say real quick that think about that, like audience, think about that, the stick of deodorant you buy, that company is more advanced in regards to knowing its customer than a medical device company.
Exactly. They know everything, basically. Yeah, they design different target groups, and then design marketing campaigns which are perfect fit for that. Yeah, and they basically know already when you put a certain set of products on the checkout, they know what type of person you are. Yeah, and then they cross-check with all the other people in their customer base and target you with similar marketing content which resonates to that persona. And transferring that to healthcare, it's of course really, really valuable in understanding which provider, which physician, for example, if you're a medical device company, who's rather innovative, who's rather cost conscious, who's the person who you can really trigger by showing scientific evidence, going into the studies and diving really deep, and having that personality understanding in advance and being able to craft your marketing and sales campaigns around that, in my opinion, can be really powerful in the healthcare sector as well.
100%. I kind of want to marry some of the piece of the future that you're describing that you guys are building with what Zed mentioned and being behind. We have a saying in device and a lot of organizations I've been a part of that where the tools dictate the rules, right? And just like the surgeons performing, a procedure that's been done for 100 years, if the tools didn't really change, they could only tweak a little bit of technique. When the new tool arrives on the scene, that can change the rules for them. And it feels like that's what you guys are building, because this is a tool with a higher power and let's say more velocity towards decision-making and getting them closer towards their customer. Am I off base there? Is that wrong?
No, that's, in my opinion, it's completely correct. Yeah. And what we try to do, especially, there are different types of medical device companies out there. Of course, there's big med tech, and they have sales reps in every city who know their providers, can go there every other day. And they, of course, have already a huge advantage through just pure market presence. But then again, there's this long tail of SMBs, medium-sized companies, startups, and so on. And in the beginning, or already also at a little bit later stage, those companies cannot afford to just walk into the practice of every provider in the country. So they need to be much more targeted to actually get the biggest bang for their buck when it comes to sales and marketing spend. And we really understand ourselves of being the tool, as you're mentioning, to be hyper targeted, really specific. Don't go to anyone where the likelihood of converting is really low. Do the work before you have to drive for 4 hours, and then save that time for your sales force. And that's where we see our sweet spot at the beginning. So, I mean, to say it in a nutshell, I mean, what's really different about us is that we are trying to help a different type of customer persona, being startups, SMB in the medical device space.
Yeah. What are the leading indicators, and what data can I have at my fingertips, whether I'm a sales rep, a sales leader, marketing leader, product manager, right?
Exactly.
To say, these are the innovators, these are the early adopters when you're looking at the adoption curve that are in these specific markets, and that have, say, enough volume where we can get traction and create a beachhead. That's what you guys are looking to build, or are building with customers.
I mean, we already have it out there, and our customers are using it every day, being successful with that. And we're really proud about how our customers can use that to bring their innovations out there. I always say, I mean, we are only an enabling technology. The real heroes out there are the innovators in the medical device space who are working daily to make patient lives better. And we are just trying to be a catalyst to help them bring what they've built out to more people at a faster rate. And then secondly, I mean, just from how our tool works and where the power actually comes from, a great deal of that is that we incorporate many data sources, unstructured data, structured data, bring that together, and then surface that in a really easy to use tool, which just feels like clicking through LinkedIn, or anything else. So usually after 10 minutes onboarding, people know how to use it and can get first insights out of there. And from a data perspective, having all those data sources, we really focused on enabling our customers to slice through multiple dimensions at once. So you can do stuff like show me all the surgeons, orthopedic surgeons in a certain area in Texas, for example, who do a certain procedure a certain amount of time, who are currently not receiving any payments from competitors, who are on LinkedIn, went to a certain medical school, and are only in the profession, for example, for 10 years. So at the beginning of their career, and then bang, you get a results list, and that's really specific to what you're looking for. And it's much more targeted, actually going out to talk to those people.
You have me excited, Paul. I'm telling you what, like, my mouth is watering right now.
Yeah, what I love about that is let's paint the parallel picture of someone who does not have access to that tool. So imagine you're in the market, and maybe your company has access to data, but you've got to email one person, and then they're going to say, what do you want to see? And you go, I don't know. I kind of want to get in there to be able to see it, but they only have one seat in the tool. And now you get this gigantic Excel sheet with 19,000 lines and 47 columns. And you just look at it and you just start drowning in, analysis paralysis. It's 4 weeks later and you haven't done anything, compared to a tool that you've built, which an individual salesperson can afford if they want, and they could go in and do exactly what you just said. And now you ended up with a list of 4. And I love 4. I don't love 19,000. When it comes to, making a decision, taking action, and having clarity in what my next step is, 4 is awesome.
And also when it comes to those 4, we in our tool, we have profile pages on 2.8 million healthcare practitioners in the country at the moment. And it's not only one thing is that targeting to find those people to go to, but then again, when you're sitting, I don't know, in your car outside of a hospital, and you just want to scroll through all the providers that could be relevant to you in that hospital, and you can go through our tool, you look at each of their profile pages where you see all of the information on them, what their therapeutic focus are, what they are publishing on which social media platform they are, and so on. So a wealth of information. You get a really good sense about them before you go in there. You can scroll through all of them, have maybe a meeting with one person, but then in the elevator, you meet another surgeon by accident. You saw him on that profile beforehand when you were sitting in your car on your tablet, and then you can talk to them, have a meaningful conversation with them, and that can also convert. So that whole thing of having the relevant content to prepare salespeople for their conversations, in my opinion, can be a big lever in facilitating more meaningful discussions with the customer in the end.
And what I love, I want to go back to the origin story because it relates to medical device. Because how many stories have you heard of medical device founders where maybe they were in healthcare, maybe they weren't, maybe they were in engineering, something, but they witnessed something that just felt wrong to them. So they had an idea and they developed it. And that's normally where that huge leap in innovation is within medical device. And so the same thing happened with you. You witnessed something that is normal to medical device. No one else would have looked at it strangely. You saw it from your perspective and said, this is abnormal. And I love that the next step was, hey, let's build a solution. Let's create a company, something out of nothing, and make a better tool to give access to more people.
Yeah, exactly. That's exactly how we started off. And I mean, we are building on that every day. I mean, those use cases we've just described are the first ones we've served. But now, as our customers give us feedback, actually we discover new use cases every day we've not even imagined when building the product, which is quite amazing. Yeah. Let me give you one example. Clark, you were mentioning product managers, for example.
Yeah.
So I got feedback from a customer where the VP of sales bought the product, and then the product team of that company looked into the product and started using it to actually look up existing providers who are already using their products. And then they were looking at what else those providers are doing to find out hints on what type of product innovations to kick off next. Yeah, because of course it's much easier to build another device, which could also be used by your existing customer base than to innovate in a completely different field. So that already influenced product development for that company, which I find quite exciting. And now we've also built something for ourselves in the beginning. As you were saying, we are new to the healthcare sector. So we built a section, the cool, which is a little bit the glossary, where you find all the information, all those different fuzzy codes. And we build a feature where you can basically search all the different procedural codes, prescription data, and so on, all the taxonomies. And now people are using that to actually search for, let's say, I don't know, all the total knee codes. And then they see, okay, of those 10 total knee codes which exist, actually billings are only majorly done for a few of those codes. So that gives you further insight for which codes you should be seeking a reimbursement path for, and so on. So, I mean, there are new use cases emerging every day, and our aim is to be just a really lean, really usable solution for medical device companies when it comes to the whole commercialization journey.
Yeah, when we started this, we talked about all of the commercial intelligence, all the data with none of the BS, right?
Yeah.
And that's really what I meant by that, is because that information exists out there, except there's two issues. It's crazy expensive, both in dollars, both, treasure and time, because it takes an enormous amount of time to sift through all that. Whether you're talking about a Memphis, Tennessee sales market, and you're rolling through people's websites and Google, and you're searching and you're doing all this stuff, and you're just trying to figure out, get those parcels of information so you have some insight into who you're calling on or who you need to target. Enormous amount of time. Guarantee is taken away from your sales time or your family time, one or the other, right? Yeah. Or you're at the commercial level on the leadership side, and you're looking for, where do we put our first headcount on the sales side? Or to your point, what codes do we try to create a pathway towards? That data exists, but this consolidates it, and time is probably the most, not probably, it is. It's the most expensive resource we have. And that's true for the startups as well, because that creates cash burn. And definitely, the more cash they're burning, the less runway they have with that tranche of financing that they have. And there are, the nature of the beast is you've got to continually fund. So this, if you can condense time like this tool does, that's massively valuable. Yeah. And regarding the pricing point, I mean, it's not only expensive,
oftentimes you don't even know how expensive it is. Yeah, I mean,
Yeah.
the dirty secret in the industry is a little bit, all those players out there, none of them have their price point publicly available on their website. What usually happens, you contact them, then a few days later you get an email from some SDR, sales development representative, and then they talk to you, they look at your company, estimate how much revenue you are making, and then you get a quote which directly perfectly fits your current revenue situation, yeah, and is probably not affordable to you, or you don't want to spend that amount of money on that. And I mean, we try to break with that a little bit. Yeah. So we not only bring transparency into the healthcare market with our solution ourselves, but we also aim to be transparent in how we communicate. Yeah. We show our product on our website. We have a transparent price point on our website. And that's how we try to a little bit get rid of that dirty secret and change the system, change the game.
I'm kind of laughing internally over here because it's not up on their website or transparent because it probably costs as much as a small house or, a fancy car.
Yeah.
With that said, I'm really curious, Paul, what drives it being so expensive, or has historically driven that price point?
I mean, one thing which is of course a driver is the proprietary data in that industry. When it comes to commercial claims data, which in the end is controlled by a set of clearinghouses in the country, which channel those claims between providers and payers on the other side. And in the end, whether you buy all payer claims data from provider A or from provider B, they all have access to somewhat agree to the same clearinghouses in the background, and you get somehow the same data. That also results in operational challenges, because if everyone is buying the same data and everyone is tackling the same providers, the same physicians who are the biggest billers for a certain procedure, then it gets really crowded there, and basically all profits and everything is competed away. So what we try to do to make our solution more accessible is we thought about a lot of data proxies which can substitute that really expensive commercial claims data. Like for example, finding other ways of finding the hidden champions, the up and rising providers, the ones who are more innovative, where it's less crowded and you still have an edge as a younger company and where you can compete. And that's what we try to do. We actually also have the opportunity to incorporate all payer claims data on demand. But I always ask my customers, do you really need it? Or do you just need it because it's like the common wisdom in the industry that everyone needs to have access to that claims data?
That's good.
And we incorporate CMS data in our tool, which already gives, for many use cases, a really strong indication in the base version of our product.
What surprised you the most since starting this company and getting to where you are now? Something you weren't expecting, or maybe something you were expecting that didn't happen? What would you say is the most surprising aspect of your journey so far?
I mean, to be honest, building that company, and we are a German-Swiss company, and building that company initially for the US market is an interesting journey. And I'm quite amazed by how open our customers are and how excited they are about that solution. That really triggers or solves a pain point for them. That's one point which I'm really surprised about that level of excitement. And then secondly, how much positive and or how much feedback we get from our customers on, that's a further use case you could establish in the future, and how they help us, like in a community sense, continue to build that product and make that better every day. And I mean, those are actually, the conversations every day I enjoy the most, when I'm in a call with my customers discussing their unique use cases, learning about their products, and figuring out ways of helping them to succeed.
I think that is a symptom of your organization figuring out a way to help them. Because what they didn't have access to, you've now given them access to. So that creates that community of, man, okay, this is awesome. Let's work together at creating something super powerful. So I love to hear that. That is great. Paul, I really appreciate you taking the time with us today. This is an awesome product. If someone is out there and they're interested to go take a look, I know they can connect with you on LinkedIn, and we'll make sure to
Sure.
put that link in there. What web address should they go to check out Alpha Sophia?
Yeah, so go to alphasophia.com and you can book a meeting with me anytime. Check out videos on our product there. You can always reach out to me on LinkedIn, give me a call. I'm always available, and yeah, looking forward to help further companies in the space figuring out their route towards the most efficient commercialization for their medical devices, and helping them bring out their product solutions to the patients who need it.
That's great. We will put that link in the show notes as well. For those of you who listen to the Medical Sales Accelerator podcast, visit medicalsalesaccelerator.com. When you do so, sign up for emails so you find out about upcoming episodes and guests. You can also download a resource to be a better communicator with all of the customers that you find on Alpha Sophia, and you can suggest a guest or an episode topic for our future.
If you found value in today's episode, do a few things for me. Subscribe to the podcast. It means you won't miss another episode as valuable as this one. Give us some stars. We love those 5 stars. Leave a review. We greatly appreciate it. And as always, go to the square with the arrow out of the top. Send it to your mama, your daddy, your friends. We greatly appreciate it. Paul, we really appreciate it. Have a great week, everybody.